take the floor.
Okay, awesome. So I hope everyone's having a great Thursday. I'm going to go ahead and share my screen. We're going to start off with a little video. So just give me a shout if you cannot hear it. Okay, Brian, if you could enable the screen sharing, that would be great.
There you go.
Perfect, thank you. So as everyone knows, we rebranded recently. So I'm gonna tell y'all about why we chose to rebrand, some of our new features, and just let me know if you guys have any questions. Okay, let's see. Okay, so it looks like I need to open the settings on my computer. So while I'm doing that, I will tell you guys a little bit about why we rebranded. So we were originally Nurse Next Door, and Joseph Kinsey, the owner, decided to rebrand to better serve our clients and just the community in general. We have grown so much over the past year and a half. I think we're approaching 2 years, but we've grown so much. So we're just looking to operate independently so we can have some new features. It will allow us to be a little bit more flexible on the pricing, and we can also serve a bigger territory. So let me see, for some reason it's not working, so I apologize. Let me see. Security and privacy to get access. Oh, here we go. Okay. Okay, hopefully this works. Let me see. Okay, can you guys see my screen? Can somebody give me a thumbs up? Okay, perfect. Let me know if you cannot hear this. Let's celebrate the little things in life, like enjoying time at home. At My Nurse Family, our goal is to keep you comfortable and safe at home. Our caregivers are available to you 24/7. With customized care plans and flexibility, let us help you celebrate the things in life that mean the most.
Most of all, friendship. And friendship has been great. And I would recommend this to anyone that needs a caregiver. You guys are at the top of the class.
Okay, so that was just a quick little video with our new little promo video. So now I'm going to show y'all our new logo and information. So we are now My Nurse Family. If this bar isn't in the way. Okay, so welcome to our new company, our new logo. The colors are purple and we do have a little bit of pink, but we rewrapped all our vehicles so they're still bright and bold. So we'll be excited to show that off once the meetings start back again in person. So this is our team. A lot of you know me and Joseph, but I'm going to tell you guys a little bit about our story and what makes us us. So Angel is our director of nursing. He had joined the Air Force after 9/11 and served overseas. And after that, he joined, or on the reserves, he went to nursing school, and that's kind of how he got into nursing. He has 5 kids now, so he stays busy after work. And he's just great. He's awesome. Sometimes he'll go and fill shifts if we need some skilled nursing, but he's super easy to talk to, and we would love for you guys to meet him. I'm sure he'll come to the chamber events once we actually do have them in person, and maybe he'll pop on a Zoom call eventually. So I'd love to introduce you guys to him. And then we have India Eatman. She is our office manager. So India started out as a caregiver, and we got so many positive reviews from clients about her. She just goes above and beyond to help people and just make sure they're happy and satisfied. So she got promoted to our office manager. So she works Monday through Friday during the regular business hours, and then she works after business hours too, because she's just awesome and loves to help whenever possible. And then there is me. So I am the marketing and business development director. So I'll usually meet with clients initially and kind of help them set up their home care, answer any questions they have. And a few people asked me how I got into healthcare. So I'm from Georgia, and that's where my family's from, but my grandmother had very bad Alzheimer's and dementia. She was one of the more combative cases and liked to punch the nurses and just, it was really bad. So that's initially how I kind of got into wanting to learn more about healthcare, just seeing her condition. And she was so smart. She got her doctorate's degree in public health. So she was just such a very intelligent woman. And just to kind of see how the brain works with the Alzheimer's and dementia was very interesting to me. So that's kind of how I got into healthcare. And then over here we have Joseph Kinsey. So a lot of you guys have met him. He is the CEO and founder, and he served in the Marines. So his background is in leadership and business. And after he served, he worked with Adult Protection Services in Texas, and he was also a caregiver for his own family. So that's a little bit about his background and why he wanted to open My Nurse Family, just because he saw how much help people need. Some people only need 2 hours a day, some people need that full 24/7 care. So he wanted to be able to help people on a very personal and one-on-one level. So that is our main team. We're here Monday through Friday, 9 to 5, and then our office is actually open 24/7. So this is gonna be your basic staff, but we all have our phones after hours, and then we have staff come in the office once we leave. So there's always someone at the local office who can help. And with the franchise, they had a call line, but they were located in Canada. So if somebody called with an emergency, they couldn't assist them. So that's one of the reasons why we're operating independently. We can assist people immediately, especially if there's an emergency or somebody calls and needs ASAP, skilled nursing care, anything we can help them with. So that is our team. Okay, so some of the new features of our company: we now have a client portal. It's called ClearCare. This is a little bit more industry standard across home care companies. So it allows you and your family to see the care notes from the caregiver. So this is really important because a lot of our clients do have some form of memory issue, whether it's Alzheimer's, dementia, or they're just getting older and they tend to forget things. But you can see the notes from the caregiver. That way you can see how your family member is doing, if they had a good or bad day. And especially if you live out of state, a lot of our clients, their families live out of the state, so they don't have that direct access to see how they're doing. So you can see that easily, and you can also see the weekly schedule. So that way you know which caregiver is coming for the week, and you kind of know who to expect. We also have more flexibility with our care plans that are tailored to your individual needs. So a lot of home care companies do have certain hour require minimums. And it's usually about 4 hours. So our minimum, if you will, is 2 hours, but it's kind of a case-by-case basis. So some people just need help showering or going to bed or getting up in the morning. And sometimes that will only take about 30 minutes to an hour. So we're flexible to kind of take on a case-by-case basis, especially if they're located in Arlington. We can help them. And we're flexible with the pricing as well. So we do have veteran discounts, and we do accept long-term healthcare insurance. So there's different options, and we'll try to find you the best rate possible. And like I said, our office is staffed 24/7. So we do have a registered nurse on staff 7 days a week. That's just to ensure that we have the best quality management. A lot of home care companies are not going to have that director of nursing. They're going to have like a CNA, certified nursing assistant, somebody managing their caregivers. But we want to have that extra step. So we have our registered nurse managing, hiring, training. That way we're, having high expectations and high quality care. And a lot of times we will get calls from people who need, their mom or dad fell in the middle of the night and they need somebody the next day for 24/7 care. And we can help them with that. So that's one reason why we are 24/7, because a lot of these accidents that happen are very unexpected. You never know when something's going to happen. And unfortunately, people wait until it's too late sometimes because they want to maintain their independence as much as possible, which is fine. But a lot of times that can result in injuries and just unforeseen things. So that's why we are 24/7, to help eliminate some of those risks. And then we also have a more open and interactive atmosphere for your family. So we launched our new website. We have blogs, about 2 coming out a week. We have videos, just some more fun and friendly atmosphere. And a lot of our blogs have information for really anyone, so you don't necessarily have to be classified as a senior. For the blogs, we have some fun things for COVID. So we have like virtual activities you can do. A lot of the zoos and museums have virtual things online right now that you can see. So we have links, you can just click on them, see there's a bunch of cool different options to kind of help you have fun while you're in quarantine, if you will. Okay, so here are some of our services offered. I know I've gone over this before, but just to break it down, there's different levels of care, but it's really customized and tailored to whatever you need. So let's say you basically just need maybe 3 hours a day, 3 times a week to help with your ADLs, which are activities of daily living. So that can include, you know, showering, dressing, meals, housekeeping, any of that. And then maybe you want someone to check on mom or dad, maybe once a month for a wellness check from a nurse so they can do your vitals. They can do a full assessment to see how you're doing. So we can accommodate that, even if it's only once a month. We've also had clients who use us when they're going out of town for vacation. They don't want to leave somebody at home by themselves. So they'll only use us for about a week and then they're good to go. And that's completely fine too. So like I said, it's very customized, very tailored. You don't have to commit to a certain number of hours or, you know, months or anything like that. So some of our services, we have the basic companionship, which is really good for Alzheimer's and dementia, just to have somebody there for oversight, to help prevent wandering, and then also to take those care notes so your family knows how you're doing. Meal preparation, word on the street is our caregivers are very good cooks. So if you want to test that out for yourself, you'll have to just hire us and see how they do. But we have a lot of good caregivers. So if somebody needs full meal preparation, we're going to match them with somebody who knows how to cook meals. And they can do simple things like heat food up in the microwave or cook spaghetti, steak, whatever, you know, the person needs. And during the consultation, I always ask people what their favorite meal is, because we want to try to find, you know, the little things to help engage them or, you know, make them smile. So we'll try to do little things to help people just be comfortable and, you know, enjoy, look forward to something in the day. We also do housekeeping. So it's light housekeeping, vacuuming, dusting, taking out the trash. And a lot of times, I will say, look out for your neighbors. Some people need help taking the recycling bin to the end of the street. There's no need to hire a company to do, you know, something as simple as that. So just look out for each other in the community. If you know anybody, offer to help, because people struggle with the little things. We've had people call and ask if we can come take their trash out once a week. And that would take maybe 10 minutes from somebody. So if you know anybody, your neighbors, then, you know, offer to help, because a little bit can go a long way for people who are older and struggling. We also do transportation, so we can take you to doctor's appointments, pick up prescriptions, groceries, run errands, any of that stuff. Personal care is going to be your showering, changing, things like that. Memory care, Alzheimer's and dementia. So again, having somebody there to prevent wandering, anything like that. Respite care, so that can be short or long term. The family just needs a break. A lot of times the family's taking off of work to care for, you know, their family member, and that can add up. So sometimes investing in home care is a good option when you're missing work, you're getting burned out. Just finding ways to help eliminate that cost might be a good investment for some people. And then we do skilled nursing, so that can include injections, wound care, full medication management, IVs. It's really whatever you need. And again, we'll find a nurse who can help you. So if somebody needs help with dialysis, we'll make sure that the nurse has experience doing that. So it is, you know, finding you a good match for whatever your need is. And that's why we do a very in-depth consultation to see how we can best match you with the caregiver. So we do 24/7 care, excuse me. A lot of people need help with overnight care if mom or dad gets up in the middle of the night, needs to use the restroom, so they'll have someone there overnight. Again, some people only need 2-hour care, so it really depends on what you need, but we can do that full 24/7, especially if you want to keep somebody home during this COVID stuff. Comfort care, that's more on the hospice side, so a lot of times we'll partner with hospice companies. Hospice will come in to help you know, the family member, and then we can be there for additional assistance if you just need a companion to sit there and watch and see how they're doing. And then we do staffing. So if you ever need any staffing help as far as you need a nurse to come in and check temperatures, do full assessments for your employees to make sure they don't have any COVID symptoms, we can do that as well. Mainly staffing is going to be for other agencies like home health, nursing homes, assisted livings, things like that. But we can help anybody who needs a nurse or caregiver, whatever it is, to come and help. So those are some of our services. So why my nurse family compared to all the other, companies out there? So we were awarded #1 home care company in Arlington by Arlington Today magazine. So thank you guys so much for all of your votes and contribution to that. We really appreciate it. And again, some of the stuff I already talked about, we're 24/7. We are licensed for skilled nursing. And when you're doing your research, make sure you do check for things like, are they licensed, bonded, and insured? Are they licensed for skilled nursing? There's just some things you want to do on your end to make sure you're getting the best care possible. And now we do serve the entire DFW Metroplex, so we can go out to Plano, Frisco, some of the areas in North Dallas that we were not able to serve before, but now our territory has expanded. So we have clients across the entire DFW area. We don't have any contracts, so like I said, it's flexible, personalized, and adaptable. One of my favorite clients we had, she started out, she just got released from rehab. She was 24/7 with us, and then she just started to get so much better after having care there, and now she doesn't need us at all. So that's always a good story because yes, we lost a client, but in the best way possible because she healed so quickly, and now she's able to kind of do the things she was able to do before. And we treat everyone like family. So this includes our caregiver, Joseph. I have never met a boss who gives so many raises and promotions and everything like that. So he loves to reward people for their hard work, which I think is really good for our caregivers because when they're doing such a good job, they need to be rewarded, especially when you are working, in home care. Sometimes it can be stressful and overwhelming depending on which clients you're working with. So it's always good to reward people for their good work. Okay, so why is home care a safe option during COVID-19? So we have the ability to customize your schedule and reduce the risk of infection. So instead of having mom and dad go out to get their groceries, you can just have the caregiver go out because you never know when you're walking into a store, you might be social distancing, you might be only going home and going to work, but you don't know what little Sally Sue has been doing at the club or the bar or wherever, especially with my millennial generation. We're probably the worst. So you never know what other people are doing. So it's just important to be cognizant of that. And having a caregiver can be a better option for these people because they will be a little bit more aware of the surroundings, wearing gloves, just doing things to kind of help reduce that spread. So we do have PPE for our caregivers, and we do offer thorough training from Angel, the Director of Nursing. So all of our staff is being constantly updated on all the CDC regulations and measures, updated on all the new information, and whenever we're getting new information from them, we'll do more and more training to keep everybody as safe as possible. And then we do daily screenings for caregivers and clients. So again, taking temperatures, checking symptoms. Our caregivers cannot clock into a shift unless they've taken that daily assessment. So that helps us keep track and have on file everybody's records to make sure everyone's being safe. And then we also will screen our clients as well, monitor their symptoms, and make sure they're doing okay. And again, home care, you have a little bit more independence, privacy, and comfort. Unfortunately, in some of these assisted living facilities, nursing homes, they're having to limit a lot of the activities they're doing. So a lot of times people will go to these facilities because they know it's going to be a community of seniors together, but unfortunately that can't really happen right now in order to reduce the spread. So staying at home, you do have that independence, you have your own privacy and comfort, and the ability to reduce hospital visits. So again, the hospitals are a hub for COVID-19, and of course they're doing everything they can to reduce this. But if you can have a skilled nurse come out and do your IV injection or whatever you need directly at home, that can be a safer option. And then a little bit of statistics. So 35% of all COVID-19 deaths have been at long-term care facilities. And that's a statistic from the CDC from June. So the cases have gone up since then. But it's just when you're in those facilities, it's a hub to spread because there's a caregiver to patient ratio. So caregivers are seeing multiple patients. It's just a lot more easily spread in those facilities. You also are not able to visit your loved ones right now. So some people are doing like window visits, which is awesome. They can see, someone through the window. They're doing what they can, but you're not actually able to go into the facility to see how they're doing. And that's going to be in rehabs, nursing homes, really anywhere, because of course they're trying to reduce that risk. Some places will allow you to sign in, do temperature checks, but a lot of them are just cutting off visitors completely. And then of course their phone lines are going crazy because people are calling, asking how their family's doing. So it's just, they're so busy and they're trying to do the best they can, but it is kind of overwhelming. And then if you do send somebody to assisted living or independent living or wherever, most of the time they're gonna have to quarantine for 2 weeks upon arrival to make sure they're not having any COVID symptoms or wait for their test results to get back. Okay, so some of our new features coming soon. We are partnering with TriWest Healthcare Alliance. So they're owned by Blue Cross Blue Shield, and their mission is to serve veterans. So they build networks of high-performing credentialed community partners that work with the VA, which is, a program for the veterans to offer as much assistance as they can. And their goal is to provide health care to veterans in their local community. And their sole focus is to help veterans. So they're strictly helping veterans get their health care. So we're really excited to partner with them because Joseph and Angel are both veterans. Here's some pictures of both of them. So they're really proud to help veterans as much as they can. And then we will be offering free CPR classes whenever some of this COVID stuff does die down. But a lot of places you have to pay to get certified. So we're gonna be offering them free at the office. That way people, can have that training. And then we can also train other agencies that have certified nursing assistants and whoever else. Okay, so here's a few cute little pictures of our clients. On the far left right there, we have one of our clients who went to the Dallas Botanical Garden. So our caregiver actually took her out there. This is one of the ways we try to find creative ways to help people have an engaging and fun experience. So they went to the garden and they also went to the zoo. They were social distancing. They had everything ready for her, just a way for her to get out of the house, to see some nature, fun things. And the son hadn't been able to take her out because he works, quite frequently. So this was a really fun way for her to kind of do something that was really enjoyable. And then we just have two of our other clients happy and smiling. The client on the bottom, she actually ended up going to a memory care. So we can help with that transition. We'll help people as much as possible. And then if they ultimately decide to go, to a facility or to memory care or wherever, we're not going to stop the care there. We'll help you transition, be comfortable, and then, we can always stay in contact if you ever need any additional support. But we kind of want to be a one-stop shop. So if you need references or referrals to go to memory care when that time comes, then we can help with that as well. Okay. And then here's our social media. So I asked this on the Facebook page a little while back, but we do some fun little things like Throwback Thursdays. We have different posts for different days of the week and blogs and stuff. So this is the one you guys helped me with, but these are some of favorite TV shows from back in the day.